You just turned 65, or maybe it's coming up fast, and you think you feel fine. You're active, independent, still doing everything you've always done. But here's what nobody tells you. The moment you cross that 65 threshold, your body starts changing in ways you can't see and can't feel until it's too late. I'm talking about biological shifts that happen whether you're ready or not, whether you believe it or not, and whether you do anything about it or not. And number 3 on this list? It's already happening inside your body right now as you watch this, silently increasing your risk of the one thing that terrifies seniors more than anything else. I'm Dr. Jennifer Cole, and I've spent 22 years specializing in geriatric medicine. I've worked with thousands of patients over 65, and I can tell you with absolute certainty that the people who thrive in their later years are the ones who understand these 5 inevitable changes and take action before problems develop. The people who ignore them? They're the ones I see in the emergency room 6 months later wondering what went wrong. In the next few minutes, I'm going to walk you through 5 biological changes that automatically begin at age 65. Not 66, not 70, but right at 65. These changes are backed by decades of medical research, and more importantly, I'm going to tell you exactly what to do about each one so you can stay healthy, independent, and active for years to come. And I promise you, what I reveal at number 1 is so critical that it affects everything else on this list. Miss that one, and nothing else matters. Important medical disclaimer. This video provides educational health information only and is not a substitute for professional medical advice, diagnosis, or treatment. Always consult your physician or qualified healthcare provider with questions about your health, medications, or medical conditions. Never disregard professional medical advice or delay seeking it because of information from this video. Individual health needs vary significantly, and what works for one person may not be appropriate for another. All medical research and studies referenced are cited in the description below for your review. Before we dive in, I need you to do 3 things right now. First, hit that subscribe button and turn on notifications because I post evidence-based health content specifically for people over 65 every single week. Second, give this video a thumbs up so more seniors can find this potentially life-changing information. And third, drop a comment telling me your age and what health topic you want me to cover next. I read every single comment and use your feedback to create content you actually need. Now let's get started with number 5. And this is something that begins affecting you the moment you turn 65, even if you can't feel it happening. Number 5. Your immune system enters permanent decline, making infections more dangerous. Here's the truth nobody wants to hear. The day you turn 65, your immune system officially enters a state called immunosenescence. That's a fancy medical term that means your immune system is aging and weakening in ways that can't be reversed. This isn't about feeling sick or having a cold. This is about fundamental changes in how your body fights off infections, cancer cells, and diseases. Let me explain what actually happens. Your thymus, the gland that produces infection-fighting T cells, has been shrinking since you were a teenager. But by age 65, it's operating at only about 15% of its peak capacity. That means you're producing far fewer new immune cells to fight off threats. At the same time, the immune cells you do have become less effective. They don't recognize threats as quickly, they don't respond as aggressively, and they don't remember past infections as well. The research on this is absolutely clear. A landmark study published in the Journal of Clinical Investigation found that people over 65 have significantly reduced antibody responses to vaccines, meaning even when you get vaccinated, your body doesn't build as much protection as it did when you were younger. Another study in the journal Immunity showed that seniors have higher levels of chronic inflammation, which actually makes your immune system work worse, not better. What does this mean in practical terms? It means that infections you used to shake off in a few days can now become serious medical emergencies. Pneumonia, which is easily treatable in younger adults, is one of the leading causes of hospitalization and death in people over 65. The flu, which might have kept you home for a week in your 40s, can now lead to life-threatening complications. Even urinary tract infections, which seem minor, can cause confusion, falls, and hospitalization in seniors because your weakened immune system struggles to contain them. I treated a 66-year-old woman named Patricia who came to my office convinced she was developing dementia. She was confused, couldn't remember simple things, was acting strangely. Her family was terrified. After running tests, we discovered she had a urinary tract infection that her weakened immune system hadn't been able to fight off effectively. The infection had spread to her bloodstream. We treated the infection, and within 3 days, Patricia was back to her normal sharp self. But if we'd caught it even a few days later, she could have gone into septic shock. So what do you do about this inevitable immune decline? First, vaccinations become absolutely critical. You need the annual flu shot, the updated COVID booster, the pneumonia vaccine, and the shingles vaccine. These aren't optional anymore. They're essential protection for your weakened immune system. Second, if you get an infection, don't wait it out. What used to be a minor infection can spiral quickly at 65. See your doctor early. Third, focus on the lifestyle factors that support immune function. Get 7 to 8 hours of quality sleep every night. Sleep deprivation absolutely devastates immune function in seniors. Eat a diet rich in fruits, vegetables, and lean proteins. Your immune system needs specific nutrients to function, and deficiencies make the decline worse. Stay physically active. Regular exercise has been shown to partially offset age-related immune decline. And manage stress, because chronic stress suppresses immune function even further. Your immune system at 65 will never be what it was at 35. That's just biology. But if you take it seriously and take action, you can maintain enough immune function to stay healthy and avoid the infections that put so many seniors in the hospital. But a weakened immune system isn't the only invisible change happening inside your body. There's another shift at 65 that affects your balance, your independence, and your risk of the injury that ends more senior lives than almost anything else. That's number 4. If you're getting value from this video so far, pause right now and hit that like button. And tell me in the comments, have you noticed any changes since turning 65? Your experiences help other viewers know they're not alone. Number 4. Your muscle mass begins rapid decline, increasing fall risk and frailty. Most people think muscle loss is something that happens gradually over decades. That's partially true. You do lose some muscle mass starting in your 30s and 40s. But here's what changes at 65. The rate of muscle loss accelerates dramatically. After 65, you lose muscle mass approximately 2 to 3 times faster than you did in your 50s. This condition is called sarcopenia, and it's one of the most dangerous age-related changes because it directly leads to falls, fractures, disability, and loss of independence. The statistics are sobering. According to research published in the Journal of the American Geriatric Society, adults over 65 lose an average of 3% of their muscle mass per year if they don't take active steps to prevent it. That means by age 75, you could have 30% less muscle mass than you had at 65. And it's not just about looking thinner. Muscle loss means you become weaker, your balance deteriorates, your bones become more vulnerable, and simple tasks like climbing stairs, carrying groceries, or getting out of a chair become increasingly difficult. Here's why this matters so much. Falls are the leading cause of injury and death in people over 65. According to the Centers for Disease Control and Prevention, 1 in 4 seniors falls every year, and falls cause over 3 million emergency room visits annually. Most of these falls happen because of muscle weakness and poor balance, both direct results of sarcopenia. Even worse, a major fall often marks the beginning of a rapid decline. Hip fractures, which frequently result from falls, have a 1-year mortality rate of up to 30% in seniors. That means nearly 1 in 3 people who break a hip after 65 don't survive the year, often because the injury triggers a cascade of complications. But muscle loss doesn't just affect your risk of falling, it also impacts your metabolic health. Muscle tissue burns calories even at rest, so as you lose muscle, your metabolism slows down, making it easier to gain weight and harder to maintain a healthy body composition. Loss of muscle also contributes to insulin resistance, increasing your risk of type 2 diabetes. And perhaps most importantly, muscle mass is directly correlated with longevity. Multiple studies have shown that seniors with higher muscle mass live longer and maintain independence later into life than those with low muscle mass. I had a patient named Robert, a 67-year-old retired accountant, who came to see me after falling twice in 3 months. He hadn't broken anything, but he was terrified it would happen again. When we did a body composition analysis, we found that Robert had lost significant muscle mass over the previous 3 years. His legs were particularly weak, which explained why he was losing his balance. We started him on a resistance training program, working with a physical therapist who specialized in seniors. 6 months later, Robert had regained muscle strength, his balance improved dramatically, and he hadn't fallen again. He told me he felt more confident and capable than he had in years. So what can you do about sarcopenia? This is one area where you have significant control, but you have to take action. First and most important, you must do resistance training. I'm talking about lifting weights, using resistance bands, or doing bodyweight exercises. Cardiovascular exercise like walking is great for your heart, but it does not prevent muscle loss. You need to actively challenge your muscles with resistance. The American College of Sports Medicine recommends strength training at least 2 to 3 times per week for seniors, targeting all major muscle groups. If you've never done resistance training, work with a physical therapist or certified trainer who has experience with older adults. They can design a safe, effective program for your fitness level. Second, protein intake becomes crucial. Your body needs protein to maintain and build muscle, but as you age, you actually become less efficient at using dietary protein. Research shows that seniors need more protein than younger adults, approximately 1 to 1.2 grams per kilogram of body weight per day. That means if you weigh 150 pounds, you need about 70 to 85 grams of protein daily, spread across your meals. Good sources include lean meats, fish, eggs, dairy, beans, and legumes. Many seniors simply don't eat enough protein, which accelerates muscle loss. Third, get enough vitamin D. Vitamin D is essential for muscle function, and deficiency is extremely common in people over 65. Studies have linked vitamin D deficiency to increased fall risk and muscle weakness. Have your doctor check your vitamin D levels and supplement if needed. The bottom line is this: muscle loss at 65 is inevitable if you do nothing. But if you take action with resistance training, adequate protein, and proper nutrition, you can maintain and even build muscle well into your 70s, 80s, and beyond. That maintained muscle keeps you independent, active, and safe from falls. But there's another change happening at 65 that's even more insidious because you absolutely cannot feel it happening until serious damage is done. And this one, number 3, is affecting your brain right now as you watch this video. Drop a comment right now telling me if you do any resistance training or strength exercises. And if you don't, tell me what's stopping you. I want to help you overcome those barriers. Number 3, your brain begins shrinking, silently affecting memory and cognitive function. This is the change that scares people most, and for good reason. Starting at age 65, your brain physically shrinks. Not a little bit, not in a way that doesn't matter. It shrinks measurably, progressively, and in ways that directly impact your memory, thinking speed, and cognitive abilities. This process is called brain atrophy, and while some degree of it is normal aging, what happens at 65 marks an acceleration that puts you at significantly higher risk for cognitive decline and dementia. Let me explain what's actually happening. Your brain is made up of billions of neurons, brain cells that communicate with each other through connections called synapses. Starting in your 20s, you begin losing some neurons and synapses naturally. But after 65, this loss speeds up. Studies using brain imaging have shown that the brain shrinks by approximately 0.5% per year after age 65. That means by age 75, your brain has shrunk by about 5%. The areas most affected are the frontal lobes, which control decision-making and complex thinking, and the hippocampus, which is critical for forming new memories. At the same time, changes occur in the brain's white matter, the nerve fibers that connect different brain regions. These fibers develop lesions and damage, which slows down communication between brain areas. Think of it like your brain's highway system developing potholes and detours. Information still gets where it needs to go, but more slowly and less efficiently. The research on this is extensive and sobering. A comprehensive study published in the journal Neurology followed thousands of adults and found that cognitive decline accelerates significantly after age 65, with processing speed and memory being the most affected areas. Another major study in JAMA Neurology found that by age 70, approximately 16% of people have mild cognitive impairment, and by age 85, that number rises to nearly 40%. What does this mean for you practically? You might notice that you forget names more easily, that it takes you longer to learn new information, that you walk into a room and forget why you went there, or that multitasking becomes harder. These are early signs of normal age-related cognitive decline. But here's the critical point. Normal cognitive aging should not prevent you from living independently or managing your daily activities. If cognitive changes start interfering with your ability to handle finances, medications, driving, or other important tasks, that crosses the line from normal aging into potential dementia, and you need to see a doctor immediately. The scariest part about brain shrinkage and cognitive decline is that it's happening silently, gradually, over years. By the time you or your family notices significant problems, substantial damage has already occurred. That's why prevention and early intervention are so crucial. I treated a 70-year-old man named William who came to my office because his wife noticed he was having trouble managing their finances, something he'd always handled easily. He'd miss bill payments, make calculation errors, and forget important financial deadlines. William insisted he was fine and that his wife was overreacting. We did cognitive testing and brain imaging and found that William had mild cognitive impairment with signs of early dementia. We were able to start treatment early, implement cognitive strategies, and significantly slow his decline. But if his wife hadn't insisted he see me, William might have gone years without help, losing valuable time when interventions are most effective. So what can you do to protect your brain after 65? The good news is that unlike some age-related changes, you have enormous power to influence your brain health through lifestyle choices. First, physical exercise is the single most powerful intervention for brain health. Numerous studies have shown that regular aerobic exercise increases brain volume, improves memory, and reduces dementia risk. The American Heart Association recommends at least 150 minutes of moderate-intensity aerobic exercise per week. This doesn't mean you need to run marathons. Brisk walking, swimming, or cycling are excellent choices. Second, keep your brain intellectually stimulated. Learning new skills, reading challenging material, doing puzzles, learning a language, or taking classes all build what scientists call cognitive reserve. Think of cognitive reserve like a savings account for your brain. The more you have, the longer you can withstand age-related changes before you develop symptoms. Research shows that people with higher education levels and mentally stimulating careers have lower dementia rates, not because they don't get brain changes, but because their brains can compensate better. Third, manage cardiovascular risk factors aggressively. High blood pressure, high cholesterol, diabetes, and obesity all damage blood vessels in the brain and accelerate cognitive decline. What's good for your heart is good for your brain. Keep these conditions under tight control with medication and lifestyle changes. Fourth, stay socially connected. Loneliness and social isolation are independent risk factors for cognitive decline and dementia. Regular social interaction keeps your brain active and engaged. Join clubs, volunteer, maintain friendships, and stay connected with family. Fifth, get quality sleep. During sleep, your brain clears out toxic proteins that accumulate during the day, including amyloid and tau proteins that contribute to Alzheimer's disease. Chronic sleep deprivation is strongly linked to increased dementia risk. If you have sleep problems, especially sleep apnea, get them treated. Sixth, eat a brain-healthy diet. The Mediterranean diet and similar eating patterns rich in vegetables, fruits, whole grains, fish, and healthy fats have been repeatedly shown to reduce cognitive decline and dementia risk. Your brain will change after 65. That's inevitable. But the extent of that change and how it affects your life is largely within your control. The choices you make today about exercise, mental stimulation, cardiovascular health, sleep, and diet will determine whether you maintain sharp cognitive function into your 80s and beyond or whether you develop serious cognitive impairment. But protecting your brain and muscles won't matter much if you ignore the next change on our list, because number 2 affects a system that, when it fails, can end your life in minutes. Before we continue, make sure you're subscribed to this channel. I'm creating a complete series on healthy aging after 65, and you don't want to miss the upcoming videos. Hit that notification bell now. Number 2. Your heart and blood vessels age rapidly, dramatically increasing cardiovascular risk. At 65, your cardiovascular system crosses a critical threshold. Heart disease is already the leading cause of death in the United States, but after 65, your risk skyrockets in ways that catch many people completely off guard. Here's what's happening inside your body. Your heart muscle itself changes. The walls of your left ventricle, the main pumping chamber, become thicker and stiffer. This condition, called left ventricular hypertrophy, means your heart can't fill with blood as efficiently and can't pump as forcefully. At the same time, the cells in your heart's natural pacemaker, the sinoatrial node, decrease in number, which is why irregular heart rhythms like atrial fibrillation become much more common after 65. But it's your blood vessels that undergo the most dangerous changes. Your arteries, which should be flexible and elastic, become stiff and rigid. This process, called arterial stiffening, causes your blood pressure to rise even if you've never had high blood pressure before. Studies show that more than 65% of people over 65 have high blood pressure, compared to only about 30% of people in their 50s. At the same time, atherosclerosis, the buildup of plaque inside your arteries, accelerates. Even if you have perfect cholesterol levels and healthy habits, decades of life have allowed some plaque to accumulate. After 65, that plaque becomes more unstable and more likely to rupture, triggering heart attacks and strokes. The statistics are stark. According to the American Heart Association, 83% of people who die from coronary heart disease are 65 or older. Your risk of having a heart attack or stroke increases exponentially after 65, and the likelihood of those events being fatal is much higher than in younger adults. I'll never forget a patient named Eleanor, a 68-year-old retired librarian who considered herself healthy. She didn't smoke, she walked regularly, and she had no family history of heart disease. But she'd been ignoring mild chest discomfort she occasionally felt during her walks, dismissing it as heartburn or aging. One Saturday morning, she collapsed in her garden with a massive heart attack. Fortunately, her neighbor saw her fall and called 911 immediately, and Eleanor survived. But tests revealed that she had severe blockages in multiple coronary arteries. Eleanor had assumed that because she felt generally fine, her heart was fine. That assumption almost killed her. After 65, you cannot assume your cardiovascular system is healthy just because you feel okay. Heart disease often develops silently over years before causing symptoms. By the time you feel chest pain or shortness of breath, you may already have significant blockages. So what do you do about this inevitable cardiovascular aging? First, you need regular monitoring. This means annual checkups that include blood pressure measurement, cholesterol screening, and discussion of symptoms. If you have any cardiovascular risk factors like diabetes, family history, or previous heart problems, you may need more frequent monitoring and possibly testing like stress tests or echocardiograms. Second, blood pressure control becomes absolutely critical. The target blood pressure for most people over 65 is less than 130/80. If your blood pressure is higher, you likely need medication. Don't resist taking blood pressure medication because you think it means you're unhealthy. High blood pressure at 65 is extremely common, and leaving it untreated leads to heart attacks, strokes, heart failure, and kidney disease. The medications work, they're generally well tolerated, and they can save your life. Third, if you're not already on a statin for cholesterol, talk to your doctor about whether you should be. Current guidelines recommend that many people over 65 benefit from statin therapy, even if their cholesterol isn't dramatically elevated, because statins reduce cardiovascular risk through multiple mechanisms beyond just lowering cholesterol. Fourth, know the warning signs of heart attack and stroke, and take them seriously. For heart attacks, that means chest pressure or pain, especially with exertion, pain radiating to your arm, jaw, or back, shortness of breath, unusual fatigue, or nausea. For strokes, remember the acronym FAST: face drooping, arm weakness, speech difficulty, time to call 911. If you experience any of these symptoms, it's an emergency. Fifth, continue or start heart-healthy habits. Regular exercise, maintaining a healthy weight, not smoking, eating a diet low in saturated fat and sodium, and managing stress all reduce cardiovascular risk at any age. Your cardiovascular system at 65 is more vulnerable than it's ever been. But with proper monitoring, medication when needed, and healthy lifestyle choices, you can significantly reduce your risk of heart attack, stroke, and heart failure. Many of my patients in their 70s and 80s have excellent cardiovascular health because they take these risks seriously and work with their doctors to manage them. But everything we've talked about so far, your immune system, your muscles, your brain, your heart, all of it depends on one final factor. And this is number one, the most important change at 65 that determines whether you'll thrive or decline in your later years. Tell me in the comments right now, do you monitor your blood pressure regularly? Do you know what your numbers are? If not, that needs to change today. Number 1. Your body's ability to recover from illness, injury, and stress plummets, making resilience your most important asset. This is the big one, the master change that affects everything else. At 65, your body loses its physiological resilience. Resilience is your body's ability to bounce back from stressors, whether that's an infection, an injury, surgery, medication side effects, or even just physical or emotional stress. When you're young, your body has enormous reserve capacity. You can handle illness, recover quickly, and return to baseline function without much trouble. But at 65, that reserve capacity drops dramatically. Medical researchers call this reduced resilience frailty, and it's measured not just by one factor but by multiple systems declining simultaneously. A landmark study published in the Canadian Medical Association Journal found that frailty increases exponentially after age 65, and people who are frail have much higher rates of hospitalization, disability, falls, and death compared to those who maintain resilience. Here's what reduced resilience looks like in real life. A 65-year-old and a 35-year-old both get the flu. The 35-year-old feels terrible for a week, then bounces back to normal function. The 65-year-old also feels terrible for a week, but then experiences lingering fatigue, weakness, and difficulty recovering their baseline energy for weeks or months afterward. That's reduced resilience. Or consider surgery. A younger person undergoes a hip replacement, does rehab, and returns to normal activities within a few months. A 70-year-old undergoes the same surgery but experiences a much rockier recovery with complications, longer rehab, and possibly never regains their previous level of function. That's reduced resilience. The science behind this is complex, but it comes down to multiple systems all declining at once. Your hormone levels change, including growth hormone, testosterone, and estrogen, all of which help with tissue repair and recovery. Your stem cells, which repair damaged tissues, become less numerous and less effective. Your ability to build new blood vessels and heal wounds diminishes. Your sleep becomes lighter and less restorative. Your stress response systems become dysregulated, leaving you less able to handle physical or emotional challenges. What makes reduced resilience so dangerous is that it creates a vicious cycle. An event that wouldn't have fazed you at 50, a minor illness, a medication side effect, a stressful life event, can trigger a downward spiral at 65. You get sick, which causes you to become inactive, which causes you to lose muscle and fitness, which makes you weaker, which makes you more likely to fall or get sick again, and suddenly you've gone from independent and healthy to frail and dependent in just a few months. I had a patient named Helen, a 71-year-old woman who was active and independent. She went on a cruise with her husband and caught a respiratory infection that landed her in the hospital for a week. That hospitalization led to muscle loss from bed rest, which led to weakness and a fall at home, which led to a fractured wrist, which led to pain and depression, which led to further inactivity and decline. Within 6 months of that initial infection, Helen had gone from vibrant and independent to weak, depressed, and needing assistance with daily activities. We eventually got Helen back on track, but it took months of intensive physical therapy, treatment for depression, and careful medication management. That cascade was triggered by one illness that her 65-year-old body couldn't bounce back from the way her younger body would have. So what do you do about reduced resilience? This is where everything we've talked about comes together, because building and maintaining resilience requires a comprehensive approach. First, maintain your physical fitness. Exercise, especially strength training and balance work, is the single most powerful way to build physiological reserve. Fit older adults have dramatically better resilience than sedentary ones. Second, optimize your nutrition. Your body needs adequate protein, vitamins, and minerals to maintain resilience. Malnutrition, even subtle deficiencies, accelerates frailty. Make sure you're eating a varied, nutrient-dense diet. Third, stay on top of your chronic conditions. Uncontrolled diabetes, heart disease, or lung disease all drain your physiological reserve and reduce your resilience. Work with your doctors to keep these conditions well managed. Fourth, avoid polypharmacy when possible. Every medication you take has side effects and interactions. The more medications you're on, the more likely you are to experience problems that reduce your resilience. Regularly review your medication list with your doctor and discontinue anything that's not absolutely necessary. Fifth, maintain social connections and mental health. Isolation, depression, and chronic stress all reduce physiological resilience through hormonal and inflammatory pathways. Stay engaged, treat depression if it occurs, and manage stress through healthy coping strategies. Sixth, be proactive about preventing illness and injury. Get vaccinated, practice fall prevention, use assistive devices if you need them, and don't take unnecessary risks. Every illness or injury you prevent is one less stressor on your system. Seventh, and this is crucial, recognize when you're starting to decline and intervene early. If you notice you're becoming weaker, more fatigued, losing weight without trying, or having more difficulty with activities you used to do easily, don't wait. See your doctor immediately. Early intervention can reverse frailty, but waiting until you're in crisis makes recovery much harder. The bottom line is this: reduced resilience at 65 means you have less margin for error. Things that used to be minor setbacks can now become major problems. But if you actively work to build your physiological reserve through fitness, nutrition, medical management, and healthy lifestyle choices, you can maintain resilience and independence well into your later years. So there you have it, 5 things that happen at 65 whether you like it or not. Your immune system weakens, your muscles deteriorate, your brain shrinks, your cardiovascular system ages, and your resilience declines. None of these changes are optional, and all of them are happening right now if you're 65 or older. But here's the empowering truth. While you can't stop these changes from happening, you have enormous control over how much they affect your life. The seniors who stay healthy, active, and independent into their 80s and 90s aren't just lucky. They're informed, proactive, and committed to the lifestyle choices and medical care that protect them from the worst effects of aging. Now I want to hear from you. Which of these 5 changes surprised you the most? What health challenges are you facing now that you're over 65? And what topics do you want me to cover in future videos? Drop your answers in the comments below. I read every single one, and your feedback helps me create the content you need most. If this video gave you valuable information, please hit that like button and share it with friends or family members over 65. This is information everyone needs to know, but too many people discover too late. Subscribe to this channel if you haven't already. I post new videos every week covering health topics specifically for seniors, from managing chronic conditions to staying active to navigating the healthcare system. Hit that notification bell so you never miss content that could improve your health and quality of life. Thank you for watching. Thank you for taking your health seriously. And remember, turning 65 doesn't mean giving up or slowing down. It means getting smarter about how you take care of yourself. With the right knowledge and the right actions, your 60s, 70s, and beyond can be some of the best years of your life. Stay healthy, stay informed, subscribe, and I'll see you in the next video.